The treatment for aortic stenosis is removal of the diseased valve and replacement with a new valve. In this population around Port Charlotte, we deal with generally the elderly over the age of 70, 75, and the replacement valves in general are tissue valves made out of either cow tissue or pig valves. And these are excellent valves, have been around for a while. They have very good longevity in this age group, and it really should be the last valve anybody will need. It is put in through many different approaches surgically. The gold standard over the last 40 years has been a standard sternotomy incision, which is actually an incision in the chest where the breastbone is divided. There's a lot of minimally invasive techniques. There's a technique that involves going in through between the ribs on the right-hand side here, or what's called a mini sternotomy, where you still go through the upper part of the sternum. That actually is my preferred approach. For patients that are deemed too sick to operate on and the risk is too high, there's another technique called a transcatheter aortic valve replacement. I've been involved in many of those, and it's an excellent technique for that patient population, and that does not involve opening the chest. However, it's done through a artery in your groin, the femoral artery, and a catheter is passed across the valve backwards, and through that, over that wire, the valve is placed and it's expanded to push the old native valve out of the way. So the only real misnomer of the transcatheter aortic valve replacement is it really doesn't replace your old valve because you don't excise it. You just put the new valve inside the pre-existing valve. But it works well. The results in this population have been excellent, and we're very encouraged, and hopefully within the next year we'll have the ability to do both the surgical as well as the transcatheter valves at Bayfront Health in Port Charlotte.